Hi and welcome. My name is Jody Martin, and I'm the author of this Griffin House publication, Preschool Health and Safety Matters. And of course, we know health and safety matters for all age groups, and that book covers all age groups as well. But I want to talk today about the different aspects of health and safety, and there's so many different ones. I'm going to focus on 4, but I want you to take into consideration that the common ones are health and hygiene and disease prevention and injury and accident prevention. But think about some of the other categories such as pedestrian and transportation safety, disaster preparedness, making sure children have enough physical activity, mental and emotional health. And so there's a lot of categories that encompass making a healthy and safe environment for children and employees and families. But let's focus on those that I feel are most pertinent right now, given the most recent events of the last 2 years. And that is health and hygiene. And that is just teaching children about proper hand washing techniques and when to wash their hands and the important times before they eat and after they play outside or after they play with a pet and maybe after they play in the sand and water table. And there's a lot of different times that they should wash their hands, of course, before they eat lunch or snack, and after they blow their nose or they cough into their hands. And one of the things that we can do is help children understand the way to prevent germs from spreading. And of course, we look at surface cleaning when we look at health and hygiene and disease prevention, and the way that we clean all the different surfaces in the environment that need to be cleaned and the equipment and the toys. But helping children understand that when they sneeze or they cough, that there's airborne droplets that can be let loose into the air, and we want to help them contain those. And they either need to cough or sneeze into a tissue or maybe into their elbow or to their shoulder, and really helping them understand how germs are spread through direct contact with other people or touching surfaces, and of course airborne droplets. The other thing is injury and accident prevention, and that is taking a good look at your classroom and making sure that toys and equipment are in good repair. There's no hanging cords, there is no chemicals or cleaning supplies within the reach of children. And if you have cleaning supplies in your classroom, they're labeled in an original bottle so everyone knows exactly what's contained in that bottle. And just making sure that children are using the equipment safely and they understand how to use the equipment or play with the toys. And so there's a lot of things that you can look at in your environment. And I know there's a lot of checklists out there. There's some in my book, and there's some that you can get from the CDC or your licensing agency, NAAYC. So just making sure that you're looking at when things need to be cleaned, what the schedule is, how they need to be cleaned or disinfected, helping the children understand the disease prevention and control, and then also looking at mental and emotional health of the children and the staff and the families. Given the last couple years and what we've all gone through, we all need to look at how we can disengage the stress response and what kinds of activities can we do, what kind of activities do we provide the children and share with families. And that might be sensory activities, it might be physical activities and fresh air. That goes a long way to relieve tension and anxiety. And also playing music, either calm music or maybe fun and peppy music, but just offering activities daily that help children disengage the stress response as well as the employees, and sharing this with families so they can extend that learning at home. And breathing. Inhaling and exhaling goes a long way to disengage that stress response. So I hope that you are healthy and you have a safe and healthy environment, and I wish you well.